Smith. My name is Kaylee and I'm going to be your nurse today. Can you please state your full name and date of birth for me, please? Okay, thanks. Now I'm just going to check your ID van and scan that, confirm your order from your doctor. So it looks like your doctor has ordered that I insert a Foley catheter today. So basically what that is I insert it through your urethral meatus and it goes into your bladder, and that helps the urine kind of drain out of your bladder and relieve some of that pressure that you might be feeling. So I'm going to go ahead and put you in dorsal recumbent position. Raise the bed. Do you have, before I get started with the procedure, do you have any allergies that I should know about, such as betadine, iodine, or latex? No? Okay, great. Okay. So I'm going to go ahead and put the bath blanket across Miss Smith. She's probably covered. And Miss Smith's knees will not flex, but normally her knees would be flexed and they would be spread apart. Okay, so now I'm going to go ahead and perform hand hygiene and put on some clean gloves before I get started with the procedure. Okay. Over here. Okay. So I'm going to make sure that Miss Smith has a waterproof pad under her, and she does. So I'm going to go ahead and get started. So I'm going to take my disposable cloths that have already been warmed, and I'm going to perform perineal care on Miss Smith. So I'm going to clean the inside of her thighs and dispose of that. And then I'm going to clean one side, front to back, and dispose. And clean the other side, front to back, and dispose. And then I'm going to clean the middle, front to back, and dispose. Okay. So once that is done, I am ready to get started with the procedure. So I'm going to take off my gloves and get my kit. Okay. I'm going to open up my kit. I'm going to get my sterile gloves. Put those on. Okay, now I'll discard up that. And then I'm going to opt out of using the drape this time because it's not required in some facilities, and not using it allows me to have a better visual of things, so I'm just going to discard that. And I'm going to put this pad under Miss Smith. Normally I would ask her to lift up her hips and assist me in putting this under her, but since she's not able to, I'm just going to kind of tuck it under there, like so. Okay. And so now I'm going to carefully take apart the kit, and I'm going to get my iodine solution, and I'm going to pour it over the cotton balls and then discard. And then I'm going to get my lubricant, and I'm going to squeeze all of that into the tray and discard of that. And then I'm going to slowly and carefully take the wrapping off of my catheter, making sure that it doesn't touch anywhere outside the sterile area. And then I'm going to dip the tip of the catheter 2 to 4 inches into the lubricant. And then I'm going to get my syringe with the sterile water, and I'm going to connect it to the port. That way that can already be done whenever I get started with the procedure. And I'm just going to carefully lay that down. Okay, so Miss Smith, I'm going to go ahead and get started. I'm going to clean you once again with iodine just to make sure everything is clean. Okay, so I'm going to take one cotton ball and I'm going to clean one side, front to back, dispose. Another cotton ball. I just realized that I did not say this, but I'll go ahead and do it now. Before I get started cleaning Miss Smith with the iodine and the cotton balls, I would get my non-dominant hand and place it on the patient. And before I got started, and then with my dominant hand, I would clean Miss Smith with the cotton balls. So now I'm going to just start over. So I've done that. Now it is time to clean Miss Smith with the iodine. So clean one side, front to back, dispose. The other side, front to back, dispose. And then I'm going to take the middle, front to back, dispose. Okay, so Miss Smith is cleaned off with iodine and she is ready for her insertion. So I've already lubricated the tip, so I'm going to slowly begin to insert into Miss Smith. And I'm going to keep inserting until I see that first initial urine into the catheter, and once I see that, I'm going to continue to advance the catheter another 1 to 2 inches to ensure that it's in the bladder. So I've done that, and it looks like that Miss Smith's catheter is now in her bladder. So I'm going to go ahead and stabilize with my non-dominant hand, stabilize the catheter at the meatus. With my dominant hand, I'm going to insert the sterile water and blow up the balloon just to make sure that her catheter stays in place and doesn't come out or anything. And so now I'm going to tug on that and make sure that it's stable, and it is. So I can go ahead and take that off and dispose of that. And so then what I would do is, normally Miss Smith, there'd be something to allow me to help stabilize this catheter to her leg, but since we don't have one, we're just going to pretend. So I've stabilized the catheter to her leg, and now I would go ahead and hang the bag on the bottom of the bed. I'm not seeing there's a place, so I'll just, okay, perfect. Okay, so I've hung the bag on the bed, and so if I wanted to collect a sterile urine specimen, I could get it out of the bag immediately after the catheter insertion with that first initial urine. But after that, if I wanted to collect a sterile urine specimen, I would need to get it from the port because the bag would no longer be sterile. Okay, so I've done that, and I'm going to go ahead and take off these gloves now. So I've done that, and then I'm going to make sure that I perform kind of another round of perinatal care and clean Miss Smith off to make sure that I kind of get that betadine and everything off of her. So I'm going to go ahead and I'm going to practice hand hygiene again, re-glove with a clean pair of gloves, and then I'm going to, with my disposable wipes, I'm just going to carefully kind of clean around front to back on the sides of Miss Smith. And so I did that, and then I would make sure to clean the area, get all the trash out, take the bath blanket off of Miss Smith, make sure she's in a comfortable position. I would tell her that if she has any questions or anything like that, to feel free to let me know, or if she has any pain, just anything, she can let me know. I would, let her gown back down, lower the bed to its lowest position, make sure the bed rails are up ×2, and document the procedure. Okay, so Miss Smith is good to go. I have left the room, and I have just re-entered the room to take out Miss Smith's catheter. So, into the room. Hey, Miss Smith, it's Kaylee again. Your doctor has ordered for me to remove your catheter today, so I'm going to go ahead and ask you to please state your full name and date of birth for me, please. Okay, thanks. I'm just going to scan your wristband and verify the order once again. Okay, great. So, like I said, I'll be removing your catheter today. It won't take very long at all. It's a really fast procedure, so I'm going to go ahead and get started. So I would go ahead and At this point, Miss Smith her bed would still be lowered, so I would go ahead and take that time to raise up her bed, put her in that dorsal recumbent position, and then practice hand hygiene, put on a pair of gloves, and then I would need to empty the bag, make sure there are no contents in there or anything like that. And then, so I've emptied the bag, and I have my clean gloves on. Empty the bag. And then I've unsecured the catheter from her leg, and then I'm going to go ahead and deflate the balloon. So I'm just going to go ahead and do that. Deflate the balloon. Okay, so the balloon has been deflated, and so now I'm going to slowly and carefully remove the catheter from Miss Smith. Okay, so I'm now all done. So I would, like I said, remove everything from the bed, make sure Miss Smith is clean and dry, and you know, doesn't have any issues or anything like that. I would put her back in a comfortable position and put the bed in its slowest position, make sure the bed rails are up ×2, and document the procedure.